shift a little bit here. Thank you. Yeah. The Secretary to the Government of the Federation, Honorable Ministers here present, Directors General, Directors, ladies and gentlemen. As of today, the 29th of April 2020, 1,532 people have been confirmed to have COVID-19 in Nigeria. A record 825 tests were done, with 195 new cases identified, a high number that is distributed as follows: 80 in Lagos, 38 in Kano, 15 each in Bauchi and Ogun, 11 in Borno, 10 in Gombe, 9 in Sokoto, 5 each in Edo and Jigawa, 2 in Zamfara, and 1 each in Delta, Enugu, Nasarawa, Rivers, and the Federal Capital Territory. 255 persons have been successfully treated for COVID-19 and discharged to go home, and sadly, 44 fatalities have been recorded. The increasing figure of confirmed cases underscores the ongoing community transmission, which is a major challenge, and again necessitates a call on all of us, all citizens, not to take COVID-19 lightly, but to take ownership of initiatives for non-pharmaceutical interventions with strict adherence to public health advisories, which is to maintain social distance, practice hand and respiratory hygiene, avoid crowded places, and wear your mask or a face covering when you leave your house. These and other related measures are critical and an integral part of the strategy to ease restrictions as from 4th of May. I urge community leaders and traditional rulers to help to ensure compliance in their domains, because failure to comply can have undesired effects. Another pressing urgency is the need to provide and prepare isolation centers and more bed spaces in all states of the Federation. I wish to apply to each state authority and Federal Capital Territory to give first-line attention to this requirement in order to meet expectations and obligations. As testing ramps up, the need will become more and more obvious. It should therefore be prioritized so that we are not taken by surprise. I should take the opportunity to request elected distinguished senators, honorable members of houses of representatives and assemblies to also get involved in this effort to ensure compliance, to participate in disease surveillance and notification efforts in their constituencies, and to actively support the drive to rapidly increase bed spaces for isolation and treatment in their states. I shall also strongly urge those who test positive for COVID-19 to cooperate with the directives of authorities on isolation so as not to constitute a risk and a cause for public concern. We have completed plans to start training and capacity building of much needed intensive care workforce for various parts of the country. I am pleased to report a fruitful interaction of the Federal Ministry of Health delegation to Kano yesterday. They were well received by His Excellency the Governor and have been able to conduct an appraisal of the situation and to start working on outlines of providing technical support to the state COVID-19 task force in several aspects, as well as also planning capacity building for the frontline health workers. They also met with many influential community leaders who all expressed willingness to support the effort of the government. A full report from the team is yet to come. I shall, as usual, use this opportunity to call on our healthcare workers to continue to render service to our people while adhering to laid down standard infection prevention and control measures. An advisory on case management has been developed and is accessible online. NCDC has also released guidelines on the management of the dead who fall victim to COVID-19. I shall close by, as usual, reminding you all that arresting the spread of this dangerous virus requires our individual and collective effort, and reiterating our public health advisories to stay at home, to avoid crowds and large gatherings, to practice physical distancing by strictly maintaining a distance of at least 2 meters between people always, to use non-contact greetings, and the elderly and anyone with pre-existing medical conditions such as hypertension, tuberculosis, cancer, chronic respiratory disease, diabetes, cardiovascular disease should not attend large gatherings or crowded places and should avoid receiving non-essential guests at this time. Also use your masks and face coverings over your nose and mouth if you must leave your house. Resources and real-time information on COVID-19 can be found on the social media handles of Federal Ministry of Health and NCDC. Thank you for your attention.